So we hosted a 4-day event beginning on Thursday as a pre-conference, just for individuals who were working with youth. So we hosted Youth Mental Health First Aid, and our target audience were those natural mentors in our community. You know, the neighbors who see about the children in the neighborhood, along with our clergy, along with licensed professionals. We had child welfare. We have residents who walked in, and so we hosted that right here on the Deuces at the Midtown Center. All the feedback was positive. People were laughing and engaging, and anytime you can learn in a way that's just natural to you, just phenomenal results. For the second day on Friday, we hosted it at the Carter G. Woodson, beginning with a panel discussion featuring our local representatives, Kathleen Peters, Dara Roussan, pastors like Pastor Ayakio Watkins, residents as well, lending their voice about what mental health means to them. And then we really provided a distinction between mental illness and mental health, because we wanted everybody to know we all have mental health. We just want to get better and better and better. So today is really about the community coming together, actually facilitating the laughter, the fun, the dancing, roaring for what matters in their community. So today we had individuals who danced and did liturgical dance, and then we had people who sang homilies, and we had spoken word artists. We have residents coming over from Jordan Park. They were invited, and they're bringing all their kids. They're painting. They're just engaged. The best part was when we backed up traffic. There were members of our community driving down the road. They heard the music. They saw the dancing. They stopped in the middle of the street and just danced right along with us. And I heard some of the residents out there saying, we haven't had this kind of fun in a long time, which really speaks to the health and the wealth of this community. So we're really moving from being service oriented, although we have over 25 different service representatives here, to we as a community, we are able to heal and take care of ourselves and feed ourselves as long as we do collective action. So that's what this conference is really about. Tomorrow will be done in individual faith communities where we've asked pastors and faith leaders to talk about mental health and as power, love, and having a sound mind that the scriptures want us to have. So that's what Sunday will be about. So I'm excited. It has been a labor of love that is well worth it. Honestly, I couldn't have imagined that we would have some of the turnout that we've had and some of the deep sharing that we've had and the commitment that's been made. So I'm just excited. I am. I'm excited.
How many people could you maybe imagine have come out in the last 4 days?
Oh my goodness. So we packed out the Carter G. Woodson. So we anticipated 125. We couldn't even accommodate all those people who showed up. So we had 125 registered, along with more people were flowing in. We had sessions over at the Jamerson Center, and some individuals, again, who didn't register, but we turned no one away. So they just came in. Today, I would say we had at least 300 people on this street all day so far. And I can only imagine the amount of people that we will impact as different churches talk about this issue tomorrow. So we have some pre-surveys, post-surveys that we will be evaluating the results so that we can get out the data that really looks at what were some of the pre-ideas before coming into and sharing in some of the events, and then what happened afterwards. And really, over the course of this year, due to our newest funder, through the Foundation of Healthy St. Pete, we will be able to host free trainings and free opportunities for the community to gather around this issue for the entire year. So this is just the beginning. Honestly, this event is just the kickoff over the next year of everything that we will be doing through the Pinellas County Urban League and all of our community partners. I can't even name them all. However, the System of Care is a collaborative of several agencies that gets together to talk about the system and how do we best integrate services in order to provide seamless services. So I'm excited, I'm hopeful, and I look forward to the next event.
Okay, now you're planning on additional events. Yes. So with this 4-day event, what concrete do you hope to gain out of that?
So one is that this actually begins the conversation of people talking about mental health without necessarily whispering about it. So these 4 days were really a readiness for the community to get ready to talk about it, right? In a way that doesn't just speak about mental illness, but we're now talking about mental health. The dancing that you're seeing, the connection and the laughter that you're seeing, individuals going to movies together and talking about what it means to be well, that is the concrete, that's what we wanted to get out of this event, that individuals are actually ready to talk about it in a real way, and that we will begin to destigmatize mental illness. The other thing that we hope to get out of it is a baseline of knowledge. And so really over the past 4 days, people really have been providing their email addresses. They've been liking our ROAR page, and that provides us a baseline to begin to target our market a little bit different, so that we can say, how have your impressions about mental health? How comfortable are you? Who are you seeking help from? And so it is our goal that we start with this baseline and grow it over the next 12 months to see if we've extended our reach and if impressions and perceptions have changed. So that's what we're hoping to do over the last 4 days.
Okay. Now, with mental health, definitely being a real issue,
Yes.
Are you also looking at maybe presenting it as a career option?
Oh, absolutely. In fact, today we have 3 educational institutions. So we have Argosy University, they have bachelor levels, master level programs available for individuals who are looking to becoming well versed in substance abuse and mental health services. We have Springfield College. We have the University of South Florida here as well. In addition to their clinic is here talking about infant mental health, where I also serve. I work with that staff as well. So in addition to working for the Pinellas County Urban League, I'm still a practicing clinician. So I work with infants and families to address trauma in their lives. So that's what we're doing here. So there's lots of educational opportunities here. The Urban League, in collaboration with Grace, will be offering free trainings for behavioral health technicians. And then as a licensed clinician, I'm also a qualified supervisor. So we are hoping to do a listserv of minority clinicians that want to have additional supervision, additional support in doing this work, because we're called to serve our community.
Okay, please give me your name and
Yes.
your job title.
Yes. So my name is LaDonna Butler, and I'm the project director of the Clergy Roundtable Initiative with the Pinellas County Urban League. I'm also the licensed mental health clinician with the University of South Florida St. Pete campus.
Great, thank you.